Hi everybody, my name is Travis Gordon. I'm an osteopathic physician working for Michigan State, and I am dual boarded in family medicine and neuromusculoskeletal medicine. I've been living down here in Yucatan, Mexico for the last 3 years, and it's gone really well. I'm hoping you guys can come down and visit me, and I basically wanted to make a video so you guys understand what opportunities you might have to come down. This whole program started in 2012. The three major objectives have been always outreach work, collaborative research, and student and educational exchange. So those continue to be the pillars with which we work. And what started first was a spring break trip, and that continues today, and that's always a great experience for the students. They have a cultural day where they experience all that Yucatan has to offer, from cenotes to Mayan ruins to haciendas with amazing food. And then they get to work in their rotations, and so every day you have a different rotation. You go to different hospitals, surgical experiences, rural medicine experience, and even osteopathic medicine as well in our outreach clinic that we have and that I run. Usually when those trips end, there's not a dry eye in the crowd. There's people crying. It's great. Everybody loves it, and it's a great place to be. And I think our staff has really good support in that area as well, and we've made a great experience out of it. For the third and fourth year medical students for their clerkships, you can do a month-long rotation as well, or longer if you'd like. And you can do pretty much any rotation that you would like. We have two different hospitals from which you could choose. One tends to be a higher focus on specialties, so anything cardiology to cardiothoracic surgery to dermatology, we have all of those. One of the most interesting, and I've experienced this firsthand as well as I've seen other students experience it, one of the most interesting and valuable aspects of traveling to another country to practice medicine is that you learn lots of things. In fact, your brain is turned on just to learn because it has to. Anything from the food to the language to the style of medicine to the lack of resources to the different pathologies you're seeing, everything is different. So everybody has a great experience down here, and it's obvious as to why. Beyond that, research opportunities, that's another focus of ours. I have collaborated with students in different research projects. That's always a wonderful experience. And on a more personal level, for me, residency in family medicine was more of a pharmacologic approach, and that's very important. You have to learn how to treat different things and especially recognize emergencies, etc. I love family medicine because you see everything. And now that I'm down here, focusing more on osteopathic manipulative medicine, so my scope's a little different now. So I recognize things, I know how to treat them, but now I'm looking more for the structural issues in a body underlying those issues, and that's really fun. And so anything from vertigo to neonatal issues such as colic or GERD or bile acid diarrhea, whatever someone may have, there's something you can do with your hands always, and that's the research that I'd like to do. I've had lots of clinical experiences with these areas, and I'd like some students to come down and help me. So that's kind of my pitch. Please come down to Yucatan, the second safest city in the Americas, Merida at least, and we'll put you to work. Thank you.
Hi, my name is Allie Stapleton, and I was the Vice President of IOMO and the fundraising coordinator for the Peru Medical Service Elective back in 2018. So my first couple of years, I really wanted to get involved in international medicine. It's not something that I had experienced before, so I was really hoping to get involved. I attended my first trip to Merida, Mexico. It was a week-long trip over spring break, and it's a great combination of medical experience and cultural engagement. So you get to do a lot around the city as well as in the hospitals and things like that. So you spend 5 days rotating between different subspecialties. So you got to see hematology and oncology, surgery, pediatrics, family, OB, and OMM, which is kind of cool. There's some other ones, it just kind of depends on what your interests are. So OMM was a great experience. You get to work in our clinic down there that is run by Dr. Travis Gordon. And this trip is super unique because you get the chance to work with him. And so he's a great teacher. He's amazing with his patients, and you can really learn a lot from him. And I think that's really what makes this trip stand out from a lot of the other trips. You also get time to explore the city. It's a beautiful city. It's very safe. I know a lot of people can be concerned about that, but The city of Merida is super safe. It's very beautiful. You can really learn a lot about their culture just by being there and exploring. You also get to go visit Mayan ruins. So it's a very educational day. You get to go to cenote. We went to Chichen Itza one year. They went to Ekbalam another year. So it varies what you get to do, but it's an amazing trip overall. And I'm really thankful for my experiences that I've had there.
Hi everyone, my name is Rila Khan and I'm an undergraduate student at MSU studying human physiology, and I'm on the pre-med track. So this past spring break, I was able to go on the Community Medicine in Yucatan trip, which happens in Merida, Mexico. And on this 1 week long trip, we were given the chance to observe physicians in multiple different settings, including private, public, and rural. And during these observations, we also got to see surgeries, which was a wonderful opportunity. I can say personally that as a student in the US, I probably wouldn't be able to see surgeries. So I think this is a wonderful experience for anyone on the pre-health track or pre-med track. Along with observing and shadowing, we also have lectures from local physicians in Merida, which is a very informative experience because you get to really see how healthcare is practiced or how medicine is practiced differently in different countries as compared to the US. And if you're interested in global health and medicine like I am, that is a very informative experience. So on top of observing and lectures during the trip, we also get to do some sightseeing. We get to eat delicious food and really connect with the community, the local community in Merida, which was probably my favorite part of the whole trip. Just the connections that we built with the local organizers, and they're all there to help us and guide us and educate us through this, and it's just absolutely wonderful how deep of a connection we can really build in just 1 week. So I think that was my favorite part of the whole trip. You have so much to learn from so many different people, and overall this whole experience is just a wonderful learning opportunity. So if you have the chance to come on one of these IGH trips, I would highly recommend that you do it. No matter what your major is or what your career goal is, it's definitely going to be an amazing experience for you no matter what.